I did this for 6 weeks, and after it was probably week 4 to 5 that it completely went away. It was after that experience that I was just completely sold on the effectiveness of this peptide. Hello and welcome to the Weaponized Body Podcast. As always, my name is Dr. Ryan Hewitt. I'm your host, and today's topic is a peptide called BPC-157. A lot of you have probably heard of this peptide by now. There's a lot of hype, a lot of talk about this, a lot of marketing about this. So get this. Imagine if your body could heal like Wolverine from X-Men. You tear a tendon, you strain a ligament, bang up your knee. Instead of being out for months, your body kicks into super recovery mode. And it sounds like science fiction, right? Well, actually, there's a peptide out there called the Wolverine Peptide, and also known as BPC-157, which stands for Body Protection Compound 157. So it's exactly what it sounds like. Now, I'm going to get this out of the way right up front here. BPC-157 is not an FDA-approved peptide. So it's technically a research chemical, and everything that I'm going to share today is for educational purposes only. So this is not medical advice. But people are talking about this peptide because it seems to speed up healing. And what it does, it protects your gut and it supports your recovery. It is a naturally occurring compound in your body. So today's episode, I'm going to break down what this peptide actually is, how it works in the body, what the research is saying, and the difference between oral and injectable versions, who might be a good candidate for it and who isn't. We'll get into often why it's stacked with other peptides you might have heard of, like TB500. And why people call this the Wolverine protocol. Finally, I'll share some of the more interesting, surprising things this peptide has been shown to do that you may not be aware of. So let's get it going. So what exactly is BPC-157? So again, it stands for Body Protection Compound. So it's a small peptide or a chain of amino acids that was originally discovered in gastric juices. So in other words, stomach juice or stomach acid. In other words, your body already produces a larger protein that scientists isolated and a piece of it seems to have that powerful protective healing effects. Keep in mind your stomach acid, right? So hydrochloric acid. It's a very caustic acid. So your body produces interesting chemicals to make sure it protects its own lining. So what makes it BPC-157 unique is that it's stable in stomach acid. So which is why you'll see oral versions of this peptide. Most peptides get destroyed in your gut, but this BPC-157 can survive that harsh environment and it still remains active, which is, again, why oral and injectable versions are used in the peptide world, both for different reasons, although similar effects. We'll get into that in a bit. Because of its regenerative potential, I got the nickname the Wolverine Peptide. So people notice that whether it's like tendon injuries or ligament injuries or gut issues, BPC-157 seemed to be helpful with the body's ability to bounce back faster than normal. Now, if we look into some of the mechanisms and the biochemistry of it, so it seems to work through multiple pathways. So let's list them out. So the first one that BPC is known for is it promotes something called angiogenesis, which means it helps with growth of new blood vessels into the injured tissue. More blood flow equals more nutrients, aka faster repair. I also have a device in my office called SoftWave. SoftWave it's a sound wave device, and it's been shown to promote similar mechanisms in the body that promote this angiogenesis behavior. The second thing that BPC has been shown to do is it stimulates what are called fibroblasts and collagen production. These are both essential for repairing connective tissue like tendons and ligaments. The third thing is it has a strong anti-inflammatory effect. Where it modulates the immune system, meaning that it calms down this cytokine storm, okay, this chemical storm that happens when injuries occur, right? When there's inflammation. So it's what creates the pain response as well as the swelling. So on top of that, it's also been shown in animal studies to have powerful effects on the gut lining. So it strengthens the intestinal wall. It protects against like ulcer formation and even shields against damage from non-steroidal anti-inflammatories such as ibuprofen. So there's another thing we're going to talk about is that it's also been found to increase the density or the amount of growth hormone receptors in cells. So it actually can help with more growth hormone response from the body, or more growth hormone signaling, or actually more growth hormone, cell binding. So if you're looking for a peptide that not only stimulates healing and repairs tissue, but it also protects one of the most important gateways to your health, which is your gut. And we've talked in past episodes about how important your gut health is, especially when it comes to things like your immune system, like your hormone health, etc. Now, getting into the safety and efficacy of this peptide. Now, it seems to be the elephant in the room with this one because it is not what's called an FDA-approved peptide, because the bulk of the research with this peptide is still mostly in animals. So we're talking like rodent studies on tendon injuries, ligament injuries, gut ulcers, and even actually nerve damage. So in these models, the results are impressive, though. Faster recovery, stronger tissue, reduced inflammation, improved function, etc. Now, the human evidence is still very limited. So most of what we have is anecdotal reports from athletes, patients, and doctors such as myself, that are observing people that using these and monitoring the results. I'll tell you a little story about an injury that I had. It was July 2024, and I'm in the gym doing my shoulders and arm day, and I actually have a neurological deficit on my left side. I had a cervical spine injury playing hockey when I was in my early 20s. I got hit from behind and I damaged part of my brachial plexus, and to what I believe is connected to one of the nerves that come from the brachial plexus called the long thoracic nerve. It's what stabilizes your scap, and it's got innervation into the bicep and the tricep. So actually, I do have less muscle. Actually, I have a smaller left arm than my right arm, and I do have some engagement issues in my scap on the left side because of it. Now, doing barbell movements, it does require like symmetry and balance. And I went a little bit too heavy on what's called a skull crusher, which is you're laying supine or on your back on a bench, and you're lowering the bar with your elbows, staying vertical to your forehead or your face, and then pressing up to the ceiling. And on one of the reps there with a heavier barbell, I felt a pop in my elbow. Immediately there was pain. Immediately I knew it wasn't good. The fallout from that is that my elbow swelled, and I had pain in my elbow for quite some time. I had like a big old lump on the tip of my elbow, which proved to be a bursitis issue. So the bursa in there was inflamed. There was also a bunch of inflammation around the tricep tendon. So I used my device at my office, the SoftWave. I was getting chiropractic care. I was doing some soft tissue work. I was rehabbing, and literally it didn't really get it only got maybe 50% better after months and months and months. We're talking 6 to 8 months. So right into this year. So into this spring, I had been studying and obviously working with peptides, and I figured I would give this BPC-157 a go. I said, what the heck? I'm going to do a 6-week protocol, and I'm going to inject 500 mcgs into my elbow. So subcutaneous, which meaning you go underneath the skin in the region of injury. And, once a day I would put 500 mcgs in there. And I did this for 6 weeks. And after, it was probably week 4 to 5 that it completely went away. It was after that experience that I was just completely sold on the effectiveness of this peptide. Now, I'm not saying that this is going to be the case for everybody. Keep in mind, I was doing the right things for the most part with my lifestyle. In other words, my sleep was optimized. I was conditioning and moving my body basically on a daily basis, drinking a gallon of water a day, having a protein-based whole food diet, monitoring and mitigating as much stress as I possibly could. So I was definitely pulling all 5 levers. And what this peptide allowed me to do was accelerate the healing process and just kind of get over the hump. So that's, kind of my N=1 experiment with this peptide. And, I had incredible results with it. So that sold me. Most of what we have right now are just anecdotal reports, and there is consistent feedback amongst most people. It's got low toxicity. People tolerate it well, and there's clear benefit in a lot of cases. So now, again, the disclaimer, it's not an FDA approved peptide. So we don't have long-term safety data on it in humans. We don't know every interaction in the body. So that's why if you're exploring this, you should only do it with medical oversight and have a clear understanding that it's experimental. The good news is, unlike other compounds, there haven't been reports of serious side effects at the moment, at the commonly used doses. Now let's get into the different versions, because you'll see a lot of people out there promoting oral BPC-157 versus injectable. Clearly, there's a big difference as far as the method that you're ingesting or taking it into your body. So if you're adverse to needles, especially in terms of like the BPC peptide, it's a subcutaneous peptide. So you do need, an insulin needle. You put it subcutaneous or under the skin, and you are doing it frequently. In other words, 1 to 2 times a day. So you are poking yourself routinely. So there's a larger barrier to entry with the peptide versus an oral. Very simple. It's just like taking a supplement. So what the common knowledge about the oral BPC-157 is, it's commonly used for gut healing because it's well tolerated in the gut, and it's more ingested systemically, in other words. So things like IBS, leaky gut, ulcers, people who have trashed their stomach lining from NSAIDs. It's typically, again, an anecdotal report about the benefits of this, but dosing between 250 to 500 micrograms daily, often split from sort of the morning to night dosages. People usually are reporting good results with that, with gut healing. Now, as far as the injectable BPC-157, it's done subcutaneously under the skin, and you're wanting to inject near the site of injury, usually. So this is the one that is typically recommended for like tendon, ligament, and joint injuries. And the dosing is similar, between 250 to 500 micrograms daily, sometimes twice daily with acute injuries. So what's interesting is that the oral BPC-157 has the systemic effects too, which is unusual for peptides, which is what makes it unique. So the big picture is oral for gut, systemic protection, and injectable for targeted healing. Now, who is this for and who is this not for? So who might benefit from BPC-157? Well, clearly from, my experience, I consider myself an athlete with my injury was a tendinous injury. So any athlete or active person with a tendon or ligament injury, even people recovering from surgeries too, anyone with stubborn gut inflammation, like from ulcerative colitis, IBS, or just like the effects of chronic NSAID use. People that should probably steer clear, people that are very adverse to anything that isn't FDA approved. It's not a miracle drug. There's no guaranteed results, right? If you're not comfortable with the experimental status, you want to steer clear of this. And people with like active, uncontrolled cancers, right? Because BPC does promote blood flow, right? Angiogenesis. So theoretically, there could be a risk to fuel tumor growth. So there's There's no data on that, but it's, what I would consider a reasonable precaution. Let's touch on what's called the Wolverine protocol. Many of you have probably heard that term at this point if you've been around the peptide game at all. So it's a combination peptide of BPC-157 and what's called TB500, which stands for thymosin beta. Now let's talk about why they combine it. It's because TB500 is a fragment of a protein called thymosin beta 4, which plays a role in actin regulation. So that's things like that actin is in muscle, right? Cell migration and wound healing. So it has slightly different effects than the BPC, but also contributes to the wound healing thing. BPC is more laser focused for like the tendon, ligament, gut. TB500 has more of the broad systemic healing effects. So when you stack them together, you get what's called like a synergistic effect. Again, faster healing, reduced inflammation, protection of multiple tissues at once. So like sports performance circles, you hear this stack nicknamed the Wolverine protocol. So it's basically like the closest thing that people feel they've seen to like accelerated recovery with, any sort of like, whether you want to call it a supplement peptide or tool. Let's talk about a couple other interesting facts about BPC. So unlike many peptides, BPC is actually stable at room temperature. So you don't always need to refrigerate it. The recommendation is typically to keep it refrigerated, keep it stable as far as peptides. But BPC seems to be a more stable peptide than, say, some other growth hormone secretagogues, or others. So in the animal studies, it's even been shown to protect the brain after traumatic brain injury. Which is very interesting because in my practice, for example, one thing that I've seen quite a bit of where people have had very limited results are things like traumatic brain injuries. Now, there are traumatic brain injury clinics out there and definitely practices that they've seen, really great results with things like, vestibular retraining, eye retraining, doing regenerative practices like hyperbaric chambers, red light therapy, NAD infusions, etc. BPC-157, I'm excited about the future of that in protecting neurological tissues, particularly after traumatic injuries. So because it does accelerate healing, it also may accelerate wound healing, which is why some people use it after surgeries. And there's also some very clearly like very early exploration in dentistry, and also in spinal cord injuries. So it's pretty exciting upcoming stuff. And I mentioned this previously, though, there's also some studies that show that it increases the amount of growth hormone receptors on cells. So it can actually increase the results with other peptides that you might use for recovery and healing. And we'll talk about this on potentially the next podcast, which would be growth hormone secretagogues, growth hormone releasing peptides and growth hormone releasing hormone peptides. So the bottom line is this peptide's a powerhouse. We're still early in the days of human research, but it is promising. So let's bring this home as far as the BPC peptide. So to me, it's one of the most exciting peptides for regenerative medicine. It's earned the nickname Wolverine Peptide for good reasons, right? So a lot of stubborn tendinous and ligament injuries, to gut health healing, systemic protection that has incredible potential. Just a reminder, it's not FDA approved, so it's still considered experimental. So if you're into exploring it with eyes wide open, with, ideally some guidance from legitimate sources, this could be for you. If not, there's definitely, hopefully, more and more human research in the wings that will be, hopefully released within the next few years, although not promising as far as, waiting on, clinical trials and research to be able to make something available. You might be waiting a long time. So, but listen, if you enjoyed this breakdown, I'm going to go over a few more peptide classes. I found that there's not a whole lot of information out there. There's not a lot of podcasts and information about specific peptides. So I'm going to be doing these breakdowns of specific peptides, particularly the ones that um, are the most common and the most utilized, and the ones that are, most beneficial to most people. I know I said most a lot there, but we're not talking about all kinds of, all the crazy peptides out there that are, that have all these wild, numerical, like, all these ones, sloop and all these ones. Like, there's some really great peptides out there, but the basics, ones that could be utilized by most people to get great results. This is one of them, BPC and TB500. Again, on some episodes upcoming, I'm going to be talking about growth hormone releasing peptides, which have another layer on top of this as far as helping people with recovery from wounds, as well as helping with weight loss, putting on muscle, etc. If you enjoyed the breakdown, make sure you guys subscribe. Make sure that you share this with somebody who's looking for more information about BPC, for example. I really appreciate when you guys share this information. It really helps the podcast grow, helps drive it up as far as people finding it. And, it's a tremendous, um, it's something I appreciate tremendously. And, I look forward to doing these every week, and continue to send me recommendations, you guys, as far as, some of the topics and peptides that you want to learn more about. Feel free to direct message me, send me information. I'm happy to interact, and hit on more interesting topics. So until then, stay strong, stay weaponized, stay disciplined. I'll see you guys next week.